Hi, my name is Rochelle Franklin. I'm going to be performing the prenatal education for a healthy pregnancy video today. And first, we're going to start off by providing privacy to our patient, washing our hands, and introducing ourselves to our patients, making sure that we verify our patient's name and date of birth so we have the right patient. So some of the things that we're going to go over today is prenatal care, and that includes implantation, and implantation can be detected in maternal serum or urine as soon as 7 to 8 days before expected menses. Signs of presumptive pregnancy may be discussed as well as milestones. For uncomplicated pregnancies or 40 weeks worth of pregnancy, you should expect to see your doctor every 4 weeks through 28 weeks. However, between 28 weeks to 36 weeks, we're expected to see the provider every 2 weeks. And then from 36 weeks to delivery, we're expected to see the provider weekly. At each visit, you're going to have your vital signs monitored, such as your blood pressure, weight, baby's heart rate will be measured, as well as the position of the baby will be checked. You will receive an ultrasound to determine the growth of the baby in the trimester, and then group B, strep testing between 36 to 37 weeks. At 29 to 34 weeks, though, we will discuss aspects of birthing, breastfeeding, postpartum care with the provider. History and physical exams will also be discussed, as well as pelvic exams and discussion of previous pap smear results. Risks will also be discussed, like genetic disorders. We'll have a risk sheet that will help us determine a little bit more at what risk factors we should take for you. An example of this will be, will you be at the age of 35 or older when you do have your baby? Will you have an ultrasound and the timing? So blood testing will be performed as well during this time frame. It's going to be your blood typing, which is the Rh factor is what we're looking for. The screening for anemia, so a CBC will be done, as well as checking for immunity to make sure that our patient is well protected with all their vaccines, such as like rubella, HIV will be tested, and other STIs, urine testing, and then kidney infections. We're going to be checking that out as well as we're going to be confirming the pregnancy with a blood HCG, as well as we're going to do a non-invasive prenatal testing at week 10. This is determine the presence of an extra or missing copy of a chromosome, so that will manifest in a way such as Down syndrome or an extra sex chromosome. And this is to be considered non-invasive because it's only a blood sample from the mother and does not have to do with the fetus at all. And then we're going to move on to nutrition. So we'll discuss some eating habits, such as we want our pregnant ladies to eat a lot more vegetables, fruits, whole grains, fat-free or low dairy diets, high in protein. We want to watch our sugar, especially for people who are at risk for diabetes or have gestational diabetes, saturated fats, and sodium for our patients who have some issues with high blood pressure. Limited our fine starches, such as cookies, and that's really unfortunate because we all love cookies. And some snacks. We always want to keep snacks on hand, especially healthy snacks, to avoid some nausea and other things, which we'll discuss a little later on. We really want to make sure that we're hitting our vitamins, specifically folic acid, iron, calcium, vitamin D, omega-3s, vitamin B, vitamin C. Some sources of those are going to be your fortified, enriched breads or cereals, pastas, peanuts, dark leafy green vegetables paired with citrus such as orange juice, and beans as well. The recommended weight gain is between 20 to 25 pounds. The first trimester is where we really want to see most of the weight gain, which is going to be approximately 2 to 4 pounds a week, but that is specific to where our patient lies on their BMI. So a healthy weight gain, if you are underweight and your BMI, you're less than 18.5, we want to see you gain at least 28 to 40 pounds. And then with a normal BMI, which is 18.5 up to 24.9, we want to see 25 to 35 pounds of weight gain. And then overweight BMI greater than 25 to 29.9. we want to see a weight gain of 15 to 25 pounds. Exercise that we're looking for is low impact, moderate intensity exercise such as walking, swimming, riding a bike, yoga, anything that can keep your cardiovascular system still very healthy and not put too much stress on the body as well. And we're looking for at least 3 to 4 days per week, or depending on how active the patient was before, we can increase or decrease that. Complaints that we see during pregnancies is, as I mentioned before, dizziness, specifically when we're standing up. So position changes, we want to keep them low and slow and have some kind of support. We can have belly supports. Other complaints is, of course, nausea, and we can beat that by making sure we are snacking, made worse by stress, of course, travel, certain foods and smells, spicy foods, but keeping that high protein diet will definitely help combat some of those nausea episodes. Another complaint such as pica, which is where a woman has a sense of taste that's not exactly food. It's leading to a cravings changing in their diets and intake, and they crave things such as dirt, clay, and coal, and this may be an indication of a nutritional deficiency, such as iron deficiency or anemia, or even a poor weight gain. So make sure you talk to your doctor about that. Another complaint we see is, excuse me if I say it wrong, pitulism, which is an excess salivation caused by an unconscious decrease in swallowing that may be due to nausea. And we can avoid this by avoiding starchy foods because it triggers our salivary glands, and that will help with that. So warning signs, we definitely want to be aware if there is a fever of over 100.5, that may indicate some infection. Signs of miscarriage such as a gush of blood and bleeding, and back pain, weight loss and sudden decreases, signs of pregnancies. And then severe or persistent vomiting, also known as hyperemesis, that can cause dehydration or electrolyte imbalance. And then severe diarrhea may also cause some severe dehydration and electrolyte imbalances. And those are some warning signs that we really want to keep on our tracker for our patient. Well, thank you so much for watching my video. I hope you learned a lot, and let me know if you need anything else. Thank you so much. Bye-bye.